Hi folks, one of my patients was asking about thyroid function tests, so I thought I'd go over that briefly today. But before I begin, if you like the content of this video, don't forget to subscribe, like and share. So the first thing to know is that the thyroid gland is involved in growth, development, and regulation of those things, and metabolism. And two important parts to consider in the production of thyroxine, which is the active type of product of the thyroid, is the brain, the pituitary gland in the brain, the pea-sized gland, and your thyroid, which sits here. So the first thing we normally check is something called the TSH, the thyroid stimulating hormone, and that's made by the pituitary gland, and it goes to the thyroid gland and stimulates it. So we check that first. And the first scenario I'm going to show you is the most common scenario, which is the TSH is high. That means that your thyroid gland is not functioning, it's not making thyroxine. So your brain is trying to push the thyroid to start making more of it. So in that situation, that could be a sign of underactive thyroid. So the next step would be to check a free T4 level. And if that is low and your TSH is high, that means you have an underactive thyroid. The second scenario is if you have an overactive thyroid gland. So in that situation, your T4 level might be high. And sometimes we'll also check a free T3, because sometimes some types of nodules or some diseases where the T3 is made, but the T4 can be normal. So we might check both of those. If those are very high, then this will send a signal to your brain to stop making the TSH, to stimulate the thyroid. So then the TSH will go low. So your TSH is low, your T4 is high, then that's a sign of hyperthyroidism or overactive thyroid gland. The third scenario is where the brain itself is having trouble making the TSH to stimulate the thyroid. So in that situation, the TSH would be low and your free T4 would be low as well. If that's the case, then you need more tests. You might be checking other types of hormones like prolactin, cortisol, growth factor, FSH, all these different types of hormones to see if the brain is having a problem making hormones. Sometimes you have to do an MRI scan as well to check the brain in more detail. So basically, in brief, these are the three scenarios. If you have underactive thyroid, which is the commonest thing, or overactive thyroid, or it's some problem with the brain not making the hormones. I hope this information was helpful. If you have any comments, criticisms, or questions, please feel free to ask. As always, stay healthy and keep well.